Good morning. I'm calling this meeting of the Standing Committee on Government Operations back to order. Again, my name is Julian Morse. I'm the MLA for Frame Lake and chair of this committee. I'm just going to do a quick round of introductions before we get going, starting with Ms. Reid this time.
Shaking it up. Thanks, Mr. Chair. I'm Kate Reid. I'm the MLA for Great Slave here in Yellowknife.
Mr. Hawkins.
Good morning, everyone. I'm Robert Hawkins, MLA for Yellowknife Centre. I want to appreciate the witnesses here today. I acknowledge them, as well as I'm always grateful for our millions of subscribers on social media who tune in daily for our proceedings. And lastly, Mr. Chairman, as I always say, I'm always happy to be here. Thank you.
Okay, thank you. Mr. Rogers online.
Thank you, Mr. Chair. My name is Danny Rogers. I'm the MLA for Inuvik Boot Lake, joining you online today from Inuvik. Thank you.
Thank you. And last but not least, Mr. Jericon.
Yeah, thank you, Mr. Chairman. Richard Jericon, MLA for Trinidad Willity. Masi.
Excellent. Thank you very much. So this morning, as part of its review of Bill 26, an act to amend the Public Service Act, committee is pleased to welcome Shauna Morgan, MLA for Yellowknife North, and sponsor of the bill, and several Yellowknife nurses who are appearing as individuals and not on behalf of any organization. Thank you very much for joining us. I'm going to turn the floor over to you for your presentation and to introduce yourselves, and then we'll go to Q&A after that. So over to you, Ms. Morgan.
Thank you very much, Mr. Chair, and good morning to everyone. We'll start with our introductions here. So I'm Shauna Morgan, MLA for Yellowknife North, and the sponsor of Bill 26, an act to amend the Public Service Act. And why don't we just go through one by one, and each of you can introduce yourselves. It'll just turn on for you.
Well, that's nice. I'm Tamara Holiday. I'm a registered nurse in the emergency department at Stanton. I've been in the territory for about 2 years, and prior to that, I was working in Big Stone, Cree Nation in northern Alberta.
Good morning, Commodore Hoisey. My name is Shania Clark. I'm also a registered nurse at the Stanton Territorial Emergency Department. I've worked at Stanton for about 6 years. I'm a collegial citizen. My family comes from Bechecal, and I've done all of my training here in the north.
Good morning. I'm Andrew Gregory. I'm currently the clinical coordinator in emergency in ICU at Stanton and a registered nurse. I've been in the north for about 8 years now, and I trained as a nurse in British Columbia. And it's grateful to be invited to the committee today.
My name is Sheila Leahy. I am a registered nurse. I've been a registered nurse for 45 years. I'm also a nurse practitioner for the past 19 years. I've worked in nursing in Alberta, British Columbia, the Yukon Territories, Nova Scotia, Nunavut, and the Northwest Territories. I've been in the Northwest Territories in Yellowknife and Fort Smith for 32 years. I've also worked in approximately half of the NWT communities in the health centers as well. I delivered vaccine to a number of other communities during COVID. I currently have 2 positions. I work as a relief nurse practitioner in orthopedics, which is where I am today, and I work as a relief RN in the emergency department. I was involved in the UNW since 1993. I was involved in my local, which is Local 11, Stanton Hospital, as well. I was a member of the UNW full executive. I was the first vice president for UNW and a regional vice president.
Okay, thank you. Go ahead.
Thank you, Mr. Chair. And so now I've been jinxed because the clicker was working before and now it's not advancing. Okay, we got it. Thank you to staff. So the overall purpose of this bill is to be able to empower NWT nurses. And the reason we want to empower NWT nurses is so that we attract more nurses to come to work in the NWT. As you'll see later in the presentation, we have quite a high vacancy rate. We also want to retain more nurses. We want to make sure more nurses want to stay in the Northwest Territories and keep working here. And we want to empower nurses so they can be able to bargain directly on their own behalf for both safer healthcare workplaces and better patient care. So that is the motivation that has led us all here today. Let's see if this works. Yes. So The current situation that is leading to our problems here. So we have a Public Service Act, and specifically Section 41 in the Public Service Act, that as it is now, it interferes with workers' charter rights to freedom of association. It doesn't allow people to organize themselves the way they think is best. It doesn't allow for the creation of new unions or for people to change unions or for unions to be decertified the way it's done everywhere else in the country except for Nunavut. And so our act is fairly unique, again, except for Nunavut, which derived their legislation from ours, in that it creates a monopoly situation for the Union of Northern Workers that all GNWT public service must be under the Union of Northern Workers, except, of course, for teachers, which have the NWT Teachers Association. So the legislation actively interferes and prevents nurses from having a voice of their own at the bargaining table. Now, this isn't a problem that we just realized or that I somehow just came up with as a new problem. This has long been recognized as a problem, and in fact, nurses themselves and many others have been actively fighting this problem, basically since the Act was first established in 1988. Shortly after that, a group of nurses went all the way to the Supreme Court of Canada, trying to protest the fact that they were being forced to bargain under the UNW. And at that time, they lost because the Supreme Court of Canada said that if they didn't like the situation, their avenue to try to exercise their freedoms was to essentially go to their political representatives and lobby to get the legislation changed. And since then, we do have changes in Supreme Court precedents and rulings, but that was what happened at that time. So certainly this problem has been long recognized, and yet despite that, the government has been working in consultation with the UNW for a number of years now on modernizing the Public Service Act since at least 2017. And while being aware that there's these problems with Section 41, Section 41 was explicitly left out of those, that work to modernize the Public Service Act. And the government and the UNW have gone about trying to modernize all the other aspects of it. And so that leads us to believe that, it was left out because the government and or the UNW didn't want to change that section. That's kind of the logical conclusion that I would make. So certainly within the last month there has been a joint announcement from the UNW and the government saying that they now commit to looking at Section 41 of the Public Service Act together, and that will now be phase 2 of modernizing the Public Service Act. However, it's worth noting that that announcement just said that they would look at it, and there was no indication that there is any joint understanding or recognition of what is the problem with Section 41, if there's any problem at all. So that's our current situation. So what I have proposed in my bill, it's fairly simple. It simply offers an option. It offers nurses, defined as nurses who are required to be registered under the College and Association of Nurses of the NWT in Nunavut, but just NWT nurses. So it offers those nurses the option to hold a vote amongst themselves on whether they want to bargain as a separate unit and who they want their bargaining agent to be. And that vote could be paper or a secure electronic ballot. And then if they decide to hold this vote, they could then apply to the NWT Supreme Court to have that vote authorized. And it would be up to the court to make sure that all GNWT nurses had a fair opportunity to vote and that the majority voted in favor. for the court to be able to authorize that that change is legitimate. I'll leave it there for now. Okay, and so it's important to emphasize, I think there's some misconceptions out there and fears that if this bill passes, you know, the day the bill passes or the day that it comes into effect, you know, all nurses would suddenly have no collective agreement, they would be left in limbo, they would lose all their benefits. There's things like this, ideas like this floating around, and that's not true at all. So it's important to emphasize that status quo is the default. It just offers an option. It doesn't force anyone to hold a vote. It doesn't force the vote to happen. Nothing happens automatically, even if the bill passes. So nurses could choose that they never even want to hold a vote, and then status quo is the default. Nurses could hold a vote and fail to get majority approval for any change. Again, status quo is the default. They could apply to a court. The court could reject the application. If the court felt that the vote was not fair, not credible, and there would be opportunities for others to challenge this vote in court, and if the court rejected the application, refused to authorize it, in all of those cases, we go back to the current situation, status quo. And even if the bill passes, if nurses did vote for a separate bargaining unit and the court authorized it, there is a provision in the bill that says that even then, the existing collective agreement that applies to nurses would continue to apply until they were able to negotiate a new agreement and that new agreement took effect. So there would be no period of limbo, even if it took nurses however long, years, to negotiate a new collective agreement. During that time, the existing collective agreement would continue to apply. So that effectively serves as a bridging function. So it makes sure that there's no gap in between where anybody would be left in limbo. Okay, and finally, before I turn it over to some of the nurses here with us today, I just wanted to note that if we don't allow nurses to get the best collective agreement that they can, it really is costing all of us. And so if we look at some of the trends that we've been seeing in our healthcare system, first of all, we have very concerning vacancy rates. So there's some charts up there. So as of a year ago, which is the latest stats that I have, June of 2024, we had almost a 28% vacancy rate amongst registered nurses in the territory, and that is by far the largest group of nurses that we employ. We also had almost 23% vacancy amongst licensed practical nurses and 36% vacancy amongst nurse practitioners. So we can't afford to not be able to hire more nurses and to continue to be losing nurses. And part of the cost of that we very much see is the cost that we've been seeing in terms of having to hire agency nurses, contract staff. So again, I don't have the most recent numbers, but we saw that for 2022, 2023, we spent over $5 million on agency nurses. In the following year, we spent $4.5 million on agency nurses. Certainly, all members of the Assembly know that last February we approved a supplementary budget, and that was just in addition to the normal budget of $2.4 million for costs associated with agency and contract staffing in health and social services. So we see these numbers piling up. And so I would point out that I think we can, as a territory, we can certainly afford to give nurses a better deal because it's going to save us all in the end. I'm going to go now to just pass it over to Shania Clark, who's going to speak a little bit about recruitment and retention and benefits for all NWT communities.
Merci, Shauna. Thank you so much, committee, for allowing us to speak here today. You can see here the title says that it benefits for all NWT communities, including smaller communities. I think we can acknowledge that there is a lack of representation at this table here, with the majority of the nurses being from Yellowknife, besides Sheila, who's been in several communities around the territory. So if you have anything to add at the end, please do. We can acknowledge that that smaller community perspective is missing here, along with a greater Indigenous community, because we know the more we get into these smaller communities, the proportion of Indigenous people grows in comparison to Yellowknife. For many Indigenous people around the NWT, CHINs are the primary healthcare provider that they will see in their community. There is a lack of physicians generally across Canada. That does not escape us here in the Northwest Territories. And so oftentimes CHINs, who are typically advanced nurse practitioners, are often the first people that these people will see in their healthcare center. So if we want to prioritize improving access to primary healthcare services for people around the territory, we do need to prioritize CHINs. We do understand that Indigenous people have a complex history with the healthcare system for a variety of reasons, colonial injustices that have happened over the last 100 years, racism that they experience in many different sectors of the healthcare system that we see every day, and also just a lack of services that are readily available to these people. According to Stats Canada, about a quarter of Indigenous people have unmet healthcare needs, and one of the most commonly reported reasons for that happening is just a general lack of services provided to them. That does not escape us here in the Northwest Territories. We know that most places have a physician that visits maybe weekly if they're lucky, every 2 weeks, monthly. I've heard many stories in the emergency room of patients waiting months to see a primary care physician for any sort of non-urgent need. And if it becomes urgent, oftentimes it is the CHIN who is the one that will provide that healthcare service towards them. So when we talk about prioritizing CHINs, we want to improve the recruitment and retention of these nurses there, because oftentimes they are the only ones there. They're not working in safe workplaces. Oftentimes there's just one nurse, maybe a couple more if they're lucky there. We know that we need a more competitive rate for these nurses who are working in unsafe and isolated remote communities across the Northwest Territories that have limited resources, limited infrastructure to get to those communities when there's an urgent healthcare need that often is just relied on a medevac. We can advocate for those safer working conditions, better pay to make it more competitive, and also in doing that, improve the professional development opportunities that are there for those nurses so that they can become more confident in these complex care situations that they're put in almost every day. Doing all of that there will create better support for these nurses there. And if we're having better nurses in these communities and we're having better supports there, that directly impacts the healthcare of the people in those communities, which oftentimes are an Indigenous population. So safer workplaces, better patient outcomes, better healthcare overall. Many of these points that I've just mentioned there could be brought up at the bargaining table if we had our own voice. It's a unique perspective to have, and these nurses there are often by themselves, do not have as much support, and without them there, a lot of these people in these communities would not get the healthcare that they deserve. So, not sure if you have anything to add there, Sheila, but pass it back to Sean.
Thank you so much, Shania. Okay, so next, we're going to just cover just a few of some current challenges, specifically at our Stanton Territorial Hospital. And Tamara's going to take this slide.
So I'm Tamara. Thanks again for letting us be here. I work in the emergency department at Stanton, like I mentioned, and I'm sure many of you have noticed it's been featured quite frequently in the news lately. We're seeing an increase in acuity, an increase in volume. We're frequently in gridlock, which is when there's no beds available in the hospital, so patients are stuck in the emergency department, and it's just getting worse. In critical care alone, there's currently 16.25 vacancies for registered nurses. And I recognize, as many MLAs have said, that a collective agreement for nurses is not a silver bullet. However, it is something that's critical right now to improve recruitment and retention of registered nurses. At the moment, there's currently private providers being used in Emerge. They're advanced care paramedics. They do not have a scope in the territory. They're completely private through another agency, and they're actually creating more work for Emerge nurses, but also, I would argue, is a very slippery slope to privatizing emergency care. There has also been a recent, again, what I would consider a reduction of services, despite the government arguing otherwise. There is some times next month where there will be no emergency physician on site. And the solution has been a combination of potentially telehealth, using family physicians, and I would say that this is a reduction of services. We are the largest receiving site in the territory, and we are functioning like a healthcare center. And I find this highly concerning. And this is, again, putting even more work on our nurses who are going to have to work to a further scope. And this is just going to further burn out. So like I mentioned, this isn't a silver bullet. We need a lot more work, and we need a lot more support from our government. But right now, a major step is recruiting and retaining nurses, and I think giving us a larger voice and giving us more incentives to be here is essential.
Okay, thanks, Tamara. So next, for the next two slides, Sheila Leahy is going to cover first the question of, but why can't nurses just get what they need within the current system of bargaining under UNW?
Thank you. Thank you very much for having us here today. As I mentioned earlier, I've been involved in UNW since 1993. And I got involved because of bargaining. It was very important to me that I heard my coworkers talk about the need to have a collective agreement. I remember going to meetings in the basement of the Monkey Tree Building in 1993 to talk about this. So this is not something new. This is another opportunity where nurses have banded together, workers trying to get what's important to them. Our current collective agreement does not work effectively for healthcare workers. If you simply look at the actual book, if you look under Appendix A10, which is now called Health and Social Services Professionals, it's 8 pages. That's 8 pages of things that are the idiosyncrasies of health and social service workers. Now, if you look at A9, which is college educators, theirs is 18 pages. You look at the number of workers in UNW who work in the college versus is health and social services professionals. There's way more in health and social services, but we don't have an effective voice at bargaining. Why? Because of the way that UNW structures bargaining, each local sends 2 members to a bargaining conference. I've been to those conferences many times. And from Local 11, it's predominantly healthcare workers, healthcare professionals, and that's where a lot of the healthcare issues, things that are important to healthcare workers, to nurses, come from. But if you're a nurse in Fort Smith, you're one of a couple nurses in a very big local who's trying to get one of those 2 seats. If you're the nurse in Betchico, you're the same thing. You're in a local that's all kinds of government workers, and you're trying to get your one voice there. If you're in Fort Providence, same thing. You're probably going through either a virtual meeting. So it's very hard for our nurses to get a voice at the table under our current structure. And having a voice at the table where every proposal is talked about, it is debated, and they choose what will be a reasonable package to bring to the government of proposals. And healthcare issues just don't always make the cut because there aren't enough voices to represent the nurses, because our nurses are so scattered in most of our locals. And this has been going on historically. I got involved for that reason, to bring a nursing voice. If we want to recruit and retain, and I think recruitment is important, retention is paramount. 75% of your nurses already live here. You need to keep those 75. You need to get 25% more, but you need to keep those nurses here. These are people who reside in our communities. They contribute to our communities. They purchase locally. They become involved. They become community members. Their transfer payment. I came here, we were 5 little transfer payments, we're now 10. My family alone as a worker here. So recruitment is important, retention is paramount, and retention is a collective agreement that speaks to issues. Nurses look at the collective agreement, and there's gray areas everywhere in what is important. We want a voice at the table. There's been some talk about nurses losing their power. I'm somebody who has actually negotiated the healthcare essential services agreements in the past with the GNWT. These are negotiations. They're give and take. Not every nurse is going to be essential. But more important than that is the purpose of a nursing collective agreement is not the right to go on strike. That's nice. It's to have a collective agreement that speaks to the issues that are important to nurses. We've heard that you want to get the workers to organize, to do things. These are nurses. I have spoke to nurses in most of the regions in the NWT, and they want to have the right to organize and to have a collective agreement that speaks to their issues. The right to strike, that's not something that is the paramount reason for a nursing collective agreement. It's the right to have a collective agreement that addresses nurses' issues. I think that's probably all for that one.
Okay, thank you so much, Sheila. And I'll just add, we're trying to point out that nurses are not all essential workers by default, and so it certainly is possible that if there was a nurses-only collective agreement, that there could be some kind of job action where non-urgent health services could be suspended. But the point is that most nurses would not want to go on strike. Nurses want to be helping their patients. This is not something that anybody wants. And so the goal is not to push for a situation where they can go on strike. And certainly the threat of nurses just leaving their jobs and going and becoming locums or working somewhere else, I think is also a very strong threat that could give them a lot of bargaining power in negotiations. We'll go now to, Andrew's going to cover the idea of including more healthcare workers in a more inclusive healthcare bargaining unit.
Yeah, so during second reading, I think a few MLAs spoke to the potential of an inclusive healthcare bargaining unit. Specifically, I believe this was the vision of MLA Hawkins, which I know nurses think is smart and is needed. But right now, public service workers are stuck with the law the way it is, and that prevents any kind of an inclusive bargaining unit as things currently stand. So nurses, as the most active group who want urgent changes, obviously have no path forward, so are seeking to create one, and that's essentially what's brought us here today. On the topic of inclusion, first, I'll let MLA Morgan speak to the legal reasons why this bill had to start with just nurses. But that limitation aside, this committee should see that this bill finally creates a process driven by nurses themselves and verified by the NWT Supreme Court that opens the door to exactly this kind of inclusive future that so many people are talking about and that many desire. First and foremost, it has never been the intention to isolate nurses or to give nurses special treatment. This bill is about giving a voice to the voiceless and empowering us to use that voice to help eventually bring others in. I think if we had the freedom to redefine how we negotiate, we as a profession could achieve a lot. And there's precedent for organized nursing achieving a lot across Canada, the Canadian Health Act being one of those precedents. And my point today is just to emphasize that the vision is ultimately to include others. And that work is actually in progress with the College Association. And I know they have a desire to separate their dual mandate. And I think that there's a strong desire amongst healthcare professionals and certainly amongst nurses to have stronger association, not for the purposes of bargaining, but certainly for the purposes of having a voice. So with that work underway to establish an association either for nurses or ideally for healthcare professionals in bringing midwives, respiratory therapy, nurse practitioners and others onto the board, that could be the early foundations of a type of structure that could engage in this sort of inclusive bargaining. I think that's all I have to say.
Yeah, Thank you. And so just to explain a bit for those who are not as familiar with how things have evolved over time. So when I first started looking at this bill, certainly my intention was to see if we can include some other allied health professionals in the group that would be able to bargain separately. But the way that the Public Service Act is currently structured, it just refers to, well, basically all GNWT workers have to be under the UNW except for very specific groups that are listed as exceptions. And so to work with the act the way it is now, before it can be comprehensively changed, I was sort of required to identify a group that is referred to in law somewhere else. And so right now, nurses are referred to under the Nursing Profession Act. We know legally what a nurse is. It can be defined legally. And so I could refer to nurses. But if I wanted to include, for example, lab technicians, or even, physiotherapists, which we all know what a physiotherapist is, but in the NABT, legally, we don't know what a physiotherapist is because we don't have any law that regulates them or licenses them. And so I couldn't refer to those groups because legally they don't sort of exist in that way in the Northwest Territories. So that's a big problem, and it is something that needs to be addressed by comprehensively changing the Act, but that's why I was limited in referring only to nurses in this bill. But the vision is that the hope and the promise by the government and the UNW to make comprehensive changes to Section 41, if and when that happens, and certainly this bill is meant to be an interim solution, then workers would be more free to organize themselves according to job types that really align and make sense for them to group together. But it is important that workers themselves have control over who they group themselves together with and are not forced once again into another sort of cookie cutter. You have to be part of a group of workers that is with job types that are not necessarily aligned with each other. So just the last couple slides here to conclude. So there has been a big question of, well, doesn't this bill duplicate or perhaps interfere with the government's initiative on this phase 2 of the Public Service Act, that they're going to make these more comprehensive changes, so why do we still need this bill? So I want to make it clear that there is no conflict between this bill and the comprehensive, quote, phase 2 changes that are being promised. It doesn't interfere. The government and the UNW can certainly move ahead and work on those comprehensive changes, and they certainly are still needed. Bill 26 is intended to be an interim measure, especially given that we've seen most of our legislation recently takes at least a decade to be enacted from the moment that research is first started. And we're literally just starting in these moments this phase 2 research and work underway. And our healthcare system requires that we make retention of nurses a more urgent priority than that. And so I do want to acknowledge this joint press release that came out May 24th of this year between the GNWT and the UNW. But if you look closely at the text of the joint press release, it doesn't commit to find a solution that allows all workers the freedom of association. It doesn't commit to making sure we uphold charter rights. It commits to continuing a conversation. And so for us, that's not enough to hang our hats on and say, okay, well, we'll just stop all the work that is underway now and just hope and wait that the conversation leads somewhere. Certainly, we want to hope that will lead somewhere, but we're not putting all of our eggs in that basket, and certainly we feel that this solution can be in effect much more urgently. So finally, just to conclude, I want to emphasize that this bill attempts to design a process that would be the most free of any political interference. There has been sort of accusations or implications that by bringing this forward, that I am interfering in the process of bargaining. But I want to keep emphasizing that currently, the way the Act is right now, the status quo interferes with bargaining. And what the bill would do is open up an option, it would open up some freedom, and it would not be this assembly deciding whether or not nurses can ultimately bargain on their own or who their bargaining agent should be. It would be up to the court. That's how this bill is designed. And I think we could all acknowledge that the court is completely impartial and independent. That is its biggest strength. It's independent from the GNWT. It's also independent from the UNW executive. The court's basic role is to uphold people's rights and freedoms, and that's what this bill is about. So I would argue the court is an appropriate mechanism to address this issue of rights and freedoms and to be able to serve the role of authorizing or not authorizing. The bill also gives the court the option of decertifying any bargaining agent after it came into effect. And so, I mean, I know it was argued at second reading that the only impartial and independent mechanism that's possible here, the only legitimate mechanism is to establish a labor relations board, and the government's working on it. I would argue the court is very much impartial and independent, and actually the negotiations to establish a labor relations board would have to take place between the GNWT and the UNW. And I recognize that that's necessary, but those are the two groups with the most vested interests in this, both political interests and monetary interests. So if we were going to dream up the most impartial process possible, free of interference, I actually think it is the courts. So there may be other reasons to say the court is not the best option, and we can have that discussion, but the argument that it's not the impartial and independent option, I don't accept that argument. So that leads us to the end of the presentation, and we are happy to take questions. Masicho for your time and attention today.
Okay, thank you to the presenters. Members, I'm going to change it up a little bit, and we're going to do timed questions just because we ran out of time last time. I want to give as much opportunity for everyone to get their questions in as possible. So I'm going to give everybody 6 minutes per round. And would just say to both members and the presenters, we'll have the opportunity for more questions if people keep their questions and responses as brief as possible, understanding that you do have the time to answer questions comprehensively as need be. First member I have up for questions is Ms. Reed.
Thanks, Mr. Chair. I just started a timer. Thank you for your presentation, and thank you for outlining what nurses need. I don't disagree at all with the concerns that you've raised in terms of your working conditions and what you need as a unique group. However, Emily Morgan's presentation today does not contemplate my concern. The member characterizes this bill as setting up nurses with the ability to bargain collectively on their own. I will continue to say that's for nurses to decide for themselves. My ongoing disagreement with the bill is that it, and now this committee process that we find ourselves in, takes the crucial parts of organizing out of nurses' hands and puts it into the hands of legislators, which is in contradiction to the member for Yellowknife North's position. It is political interference and creation of a path to bargaining. As the Minister of Finance has said in her comments at second reading, this can undermine the independence of collective representation. That, to my mind, is a horrible precedent to set for workers' rights across our territory and indeed in our country. Emily Morgan has said that we all have an important role in creating and changing laws, not just to say yes or no to laws that the government brings forward, but to reimagine how things can be done. Underpinning everything I will say is this: historic best practices in labor demonstrate that workers absolutely must consult and decide on action amongst themselves first, and to find a solution that serves the majority opinion of that group. Organizing, put plainly, workers finding their own solution through unionization is a cornerstone of our democracy and a charter right, as the member has rightly noted. Workers can and should demand better of their employers. You can Google how to create a union if you like. It outlines all the basics. This is why forthcoming amendments brought forward by the Minister of Finance will go through an extensive engagement with workers and their representation before becoming a bill brought to the Assembly. The private members bill reverses this process, ostensibly to save time and makes things go more quickly. But in doing so, it takes organizing power out of workers' hands. The reason that there are strict processes and procedures for negotiations, collective bargaining, and the issues of labor writ large between GNWT as the employer and the UNW as elected representatives of the workers is entirely on purpose. These two parties have publicly committed to look at the creation of a labor board, as noted by the member, to allow the nurses a free and independent process to choose new union representation. The minister and the union cannot dictate the outcome of that work because they both cannot dictate or presuppose what workers want. Only workers can do that for themselves. In short, that's why it takes so long to get legislative change with the union. They conduct engagement extensively before a bill is brought forward, whereas the private members bill is doing the reverse. I'm well aware that my fellow members see nothing wrong with this, and I'm trying my level best to demonstrate why this is in fact a bad choice. If employees, in this case nurses, can't or don't want to work with their current elected union representation to sort out this disagreement or approach, they need to organize because they themselves hold the power of their labor, not us as legislators. If a way to verify their position and collective power cannot or will not be done by union representation currently, they must present their case to the employer, and the employer must listen and find a way to verify the employee's decisions with them. Direction for change must always come from the workers themselves. In the member's own words, I put together a bill to create a new way for nurses to be able to have a choice. The operative word is I. Today, she has used the words our act. The member is not a nurse. My argument today, and always will be, that it is absolutely not our place as MLAs to do that for nurses, no matter how well-intentioned our actions are. It infringes upon the independence of collective action by and for the workers, in this case, nurses.
Do you have a question, Ms.
I
Reed?
do. I will get to one of my questions now. I want to say, I really do recognize all of the hard work that Emily Morgan has done, and I don't think that she's coming from it out of any ill intent at all. It's just a principle I hold dear to my heart. So my question for her today then is that the bill authorizes the Supreme Court to grant an order for an applicant to bargain collectively on behalf of nurses, but it doesn't say on what legal standard the Supreme Court will use as a basic benchmark for ensuring that this process is fair, transparent, and impartial. It doesn't outline who would be responsible for administering the process. In other jurisdictions, provincial labor codes set this process. Given that the NWT does not have a labor code or any other legislation to set out this process, can the member explain why the key oversight mechanism was not included in the bill? Thank you.
Thank you, Ms. Morgan.
Yeah, thank you for the question. So I'll start by addressing the question directly and then go back to the points made in the preamble. So it would be up to the court to look at precedents elsewhere, and what is laid out in the bill is that the court has to verify or ensure that all nurses in the NWT or all GNWT nurses had a free and fair chance to vote, that the vote was opened up and there was opportunities for everyone to vote, and that the results are credible and that a majority voted in favor. And so that would, the burden of proof would be on the group making the application to show enough evidence to show that those things are true. So we're not specifying exactly what the process has to look like. We're just leaving it up to the applicant that the burden of proof would be on them to show enough evidence. And I think many of us are finding it very confusing that the member keeps insisting that what is being brought forward in this bill does not reflect any workers organizing or deciding for themselves, and that the mechanism in the bill of having nurses all vote amongst themselves somehow would not represent the legitimate will of nurses. But I think maybe the confusion is how we define workers, because it seems that the member is saying that we're taking power out of workers' hands. We are taking some power away from the UNW executive's hands. And so that's what I see as the problem, but also we have a current problem in that our legislation doesn't legislate checks and balances on our existing union structures, and it gives this monopoly. And so that's where the tension comes in. And so if the assumption is that the only legitimate voice for workers in the GNWT is the UNW executive, then I can see why the members' points make sense. But I think what we're seeing is that workers are organizing themselves. They are trying to come forward and organize and have an opportunity to vote amongst themselves, to show the rest of the world what the results of their organizing is. I don't know if any of the other people on this panel want to add anything to that. Okay, Sheila?
It's great to say that workers have the voice, but unless you are part of the portion of UNW that makes the rules, the only voice that I have as a union member is I have the right to vote and to attend a local meeting. The UNW executive has made bylaws and regulations that exclude all relief workers. I cannot even be a member of my own local bargaining committee that looks at the bargaining proposals to bring forward to help them out. I can't be part of, I can't be a vice president social committee member because a relief employee is not allowed. I am not the only one. We have 3 members who put their name forward to help with bargaining proposals, all nixed because they are relief people. Yet, many of our employees are working relief for one reason or another. So we are workers. We are for workers who cannot change legislation, but we can go through an MLA to get this changed. We can't bring this forward. And we can't bring it forward through UNW. So this is our avenue.
Ms. Morgan, do you have further comments? No, that's it? Okay, thank you. I have Mr. Hawkins next for questions.
Thank you, Mr. Chairman. I guess I'll start off this way. There's so many questions, but maybe in the sense that I'm hearing that the current situation's a bad deal and this is a good deal for nurses, but when trying to help support the nursing industry through ratios, shift premiums, banning agency nurses, I mean, there seemed to be an absence of support from my experience and interpretation of the member, but yet her new bill is going to save nurses. When positive solutions, I think, were put forward for the last year and a half. So, I'm not, what I hear is respectfully a lot of platitudes how we're going to fix nursing, but I'm not hearing any evidence specifically. So for example, when you highlight the specifics of like nursing vacancies, I could have done that, but that said, how do you, through this act, guarantee that this is going to change agencies' problems or vacancy problems? It doesn't fully address how we're going to look at the healthcare. I think that the healthcare unit itself is a bigger perspective as opposed to teasing one specific group out. And I would respectfully challenge any nurse anywhere, any day of the week to think that they tell me that their voice isn't heard. Like teachers, nurses are very articulate on their positions. So if anyone tries to tell me that they're not being heard, I'm sorry. I don't take that very comfortably and certainly at face value. In my time in politics, I have amply heard from nurses, and I welcome that, and I will continue to welcome that. But to imply that they're not being heard, I find this a bit of a juxtaposition. Well, it's my 6 minutes, Mr. Chairman. You framed 6 minutes, so you did that to Ms. Reed. Now you're doing it to me.
Do you have a question?
It's my 6 minutes. I mean, if this is how this is gonna go. Am I allowed to use my 6 minutes, Mr. Chairman?
I just want to be clear with committee members, we're going to have a lot of time for issuing comments on this bill at the appropriate times. We're here with the witnesses in front of us. We have questions that we can ask. We have other committee members that want to ask questions. If members have questions for the bill sponsor or the witnesses in front of us, they have time to ask those questions now.
Yeah. Well, Mr. Chairman, I mean, I find that offensive. I want to stress that. If we're given 6 minutes, I want to stress, then we should be allowed to use our 6 minutes and approach our questions or points where we're going. So some of us would like to use our 6 minutes, and if we wish to discuss this further, no problem. Let's call a recess and we can sort it out. But it's, I'm not even sure where I'm on the time now that you and I are going back and forth. But
You're at
that's-
3 minutes.
Thank you very much. So if I can continue, what I'd like to stress is my issue is about this bill is meant to be a catch-all. So how do we distinguish the difference between, I'm not seeing evidence, I'm only seeing platitudes. This will fix all nursing problems. And my focus will and continues to be about helping the healthcare industry. And nurses are in that industry, so please don't try to tease yourself out of it and say, well, you're not hearing us or recognize us. We could say every industry, but we'll run out of time. How is your evidence structured in a way that's transparent, that shows this bill is fixing the concerns highlighted earlier, such as problems with agency nurses, ratios, even shift premiums? Thank you.
Thank you. Ms. Morgan.
Thank you, Mr. Chair. And so I want to first acknowledge that the idea of a broader healthcare unit that includes more healthcare workers is it's a valid one for sure. There's a lot of merit to that idea, and I think this could open the door to allowing more freedom for workers to be able to organize themselves in a broader healthcare unit. I certainly never claimed that this bill itself could, in and of it, on its own, solve all the issues in healthcare. I think we all know that, and legislation can't decide what people are going to be paid, shift premiums, and what I think we tried to say in the presentation was that nurses have attempted through talking to their management or going through existing UNW structures to get those things, and they have not been successful despite best efforts, and that we feel the solution is to empower nurses to have their own voice at the bargaining table where they could actually achieve these kinds of things through collective agreements where they haven't been able to in the past, because often they're not even present at the bargaining table. And I mean, one sort of thing that I would point out is that nurses deserve a pay increase, and in order to even be competitive with other parts of Canada, they need a pay increase. However, the GNWT quite possibly can't, if a pay increase for nurses meant that a pay increase for every single member of the public service across the territory, that would be very difficult given the GNWT's fiscal realities and very unlikely. But if it was a bargaining unit carved out just for nurses and they were talking about a pay raise just for nurses, that, in my mind, would be much more likely. And so finally, I'll just point out that healthcare is not an industry. It is a public service. And so this is not about doing business. This is about protecting our overall healthcare system for all citizens. Thank you.
Okay, thank you. I have Mr. Testard next.
Thank you, Mr. Chair, and thank you for for bringing this forward. You know, I was here this morning as well and spoke to, you know, why do we need private members' bills? Well, we need them to move things forward because the existing processes are moving quite slow. And at the very least, we are having the discussion, and it's an important discussion because healthcare is fundamental to all our communities, and it's certainly been a priority of mine. You know, I do have some sympathy for the concerns that the silver bullet argument, and I know you're the sponsor of the bill and just about everyone involved with supporting the bill has said the same thing. This is not designed to be a silver bullet. This is designed to be a mechanism to strengthen the ability to move these issues forward and get resolution here. At the end of the day, we don't have a government that wants to support these issues. It's just going to be fighting with a new bargaining unit, which is not something I'm looking forward to, and certainly we want to see our government take these things seriously. I do have questions, though. There's not presuming outcomes here, because we can't presume those outcomes because a lot of them are political decisions and not policy decisions. We've seen examples of labor market supplements in the past specifically for nursing and healthcare providers. Did the sponsor of the bill consult with experts in the field or the Union of Northern Workers or anyone else on other ways that nurses could receive greater compensation or financial benefit within the current structure? Thank you.
Ms. Morgan?
Thank you, Mr. Chair. So certainly we have considered that under the current structure, there have been things like labor market supplements and appendices in the collective agreement. But it's important to emphasize that these are all one-off things. If there's an MOU, if there's a labor market supplement, it's a one-off thing. It's not something that is baked into the formula of the actual collective agreement. And so, therefore, it has to be fought for over and over and over again. And we want something that's gives nurses the ability to ensure more lasting and sustainable benefits. I wonder if, Sheila, do you have anything to add on what, whether the current system?
If not, I can.
Sure. Or Tamara?
I'll let Tamara.
Just whether the current system of just have more labor market supplements, why wouldn't that sort of solve the problem? We'll start with Sheila.
They're nice, they're a quick fix, but as Shauna has said, they are not part of the body. Just physically trying to get the text of what the labor market supplement says to be able to read the whole thing is a difficult task. It's more important to nurses to have a collective agreement that has it in the text, it is part of the body, and it addresses things. And having nurses all organized would give all nurses the right to look at supplements that are pertinent to the workforce, not just necessarily something that was negotiated by two upper powers, not the actual workers.
Andrew, did you want to have something to add?
I just wanted to jump in. I appreciate everybody's concerns on the committee, and it's just as kind of an impartial observer, I think we're going off the rails. There's nothing in this bill that promises to fix anything, and in fact, maybe things would get worse. But fundamentally, this is an issue in front. The issue for you is on that's our choice. And that's really what's at stake here, is you have a group of workers who are asking to organize or who are asking just fundamentally to have or to explore having their own collective agreement. And there's absolutely no pathway to achieve that. That's a problem for this government. And it's fundamentally a problem for the government because you have a Public Service Act that violates the Charter. So more or less all the debate today is stemming from a group of workers who are trying to exercise a fundamental charter right that we would be able to exercise in any other province and one other territory to associate. And that's all this is about. And granted, I think MLA Morgan would be the first person to acknowledge that a private member's bill is not the ideal way to go about any of that. But the point of a private member's bill is to empower a regular MLA, which all of you are, to introduce innovative solutions and to address constituents' concerns and to address gaps in legislation that Cabinet is refusing to address. And that's where we're at in 2025. We have a situation where the time has come where we want to explore exercising that right, and we can't. And it is legislation that is preventing us from doing that. So we're sitting in front of a committee today to ask you how you're going to address this legislation. Because in the modernization of the Public Service Act, what has been shared publicly is that the government is not going to address it. And there is no other proposals before us. You have the private members bill to consider and no other legislation. There is no legislative proposal to change Section 41. So that's the consideration before you, is how do we get an incremental pathway to giving us our rights? That's what we're trying to fix. All of the rest of it, I think, should be left absolutely appropriately to the union and to the bargaining table and to discussions between a group of employees and their managers. But that's all.
Okay, thank you. We're going to move on to round two. Ms. Reed, I have you up first.
Thanks. Just really quickly at the top, I guess my commentary at the beginning, I just want to clarify. I am saying if the UNW is not the solution for you, you do hold the power in your own hands as it stands, and my concern is political interference on part of the MLA who is not the employer. I'll leave it at that. So in my time speaking with nurses on the draft version of this bill, they noted that they understand that the processes for any path forward to the end goal of a separate bargaining unit will take quite a long time. They were, at the time, encouraged by my support of an independent labor board to get them to the ends that they wanted as a separate group, and I believe they understood my perspective that I've outlined today. So creating a collective agreement can take years and years of back and forth between a union and an employer. So my second question is one of curiosity. In her presentation, the MLA notes that the retention of nurses is an urgent priority, which we all agree on. Why is the MLA characterizing this bill as a quicker solution best suited to a time-sensitive result? Thank you, Mr. Chair.
Thank you. Over to Ms. Morgan.
Thank you, Mr. Chair. If there's time for more back and forth, I am super curious to understand better the members asserting that workers currently have the option in their hands, and I think said earlier that if they can't further their needs or position through the UNW, they would just need to present their position to their employer. I honestly have no idea what that refers to, so I would love to know more what you're talking about. On the issue of time sensitivity, yeah, certainly collective agreements do take a while to negotiate, and that's why starting sooner rather than later would be a good thing. I think the idea is to have this option opened up as soon as possible, and that might in and of itself be sort of a boost to morale and give some workers the hope to at least hang on for a few more years and work towards, feel empowered and work towards getting what they need. Even if it does take, as you're saying, a couple of years to negotiate the agreement, at least there will be an active process underway that they're participating in. And I think when workers are engaged and they're actively, working towards getting what they need, then morale can go up through that process. I don't know if anyone else has anything to add. No? Okay.
Okay, thank you. Ms. Reed.
Mr. Chair.
3.5 minutes.
Thanks, Mr. Chair. Well, it's a little odd to ask questions of the people who are questioning, but I'll try my best to continue to explain myself. And I've been trying to be very high level on purpose because, again, I really truly believe that it is not a politician's place to interfere in any aspect of finding a voice for yourself as a singular group of workers that have specialized needs. I think everybody in this room can agree that is the case that we see ourselves today. You spoke today a little bit about the legitimacy under the Act around bargaining for folks who are public servants, including GNWT nurses. My point I'm trying to make is that there have been plenty of historical examples of people organizing without legislative legitimacy and demanding change from their employer. There is nothing that is restricting nurses from doing that work themselves, if that is indeed what they want. If the member wants to ask me questions, I suppose she can. Thank you, Mr. Chair.
Was that a question? Ms. Morgan?
No, I mean, I think we spoke in our presentation to the challenges that nurses have had, just going to their own employer, going to their management, trying to get their issues addressed and resolved through just talk to your manager, through these kind of channels, that it has not been adequate. And honestly, if it was as simple as all workers can get what they need by going to their employer, then we probably wouldn't need unions at all, because you would just sort it all out without having to go to a bargaining table at all. But yeah, Tamara, if you want to add something?
So personally, I've met with, I think, quite a few of the MLAs at the table. I've met with the PA, I've met with the CEO, the COO, my manager. We're not seeing action. I'm running out of people to talk to, and I'd love to know who else there is, because we've gone to the MLA, we've gone to the union, we have gone up all the levels, and we are still working in unsafe patient conditions. We're overworked, we're understaffed. And I don't see another solution forward other than bargaining if no one else is going to do this for us while we talk to them.
I see that you have some comments.
I think I just wanted to say that I think idealistically, MLA Reid and I share the same view. I think practically, there's just a disconnect in the challenges that we face if we try to achieve what you're suggesting. It is an enormous risk for us to take on. We're employees of the GNWT. We're bound by the code of ethics of the GNWT. To do any kind of this organizing that is suggested would require us fundamentally breaking that. And we're also members of the UNW. And some of us at the table have positions on our local. And, we have to, as, wearing different hats as everybody does in society, especially at work, we're fundamentally union members and proud union members. And that in that role, we're bound by the Constitution of the Union and PSAC, and we have to uphold, what the goals of the union are and what convention prescribes. So to do any kind of independent organizing or, that's a guaranteed pathway to suspension from the union and to having even less of a voice than what we have now. So I think we share this vision of, that workers can organize and fundamentally, ultimately get what they want, but it should not go unsaid how ugly that can get and how challenging that can get, and the risk that's put on us. So I think that what you're seeing is us choosing the route of politically lobbying and engaging, stress testing the democracy that we live in, to see if our elected representatives can, through their work in the Legislative Assembly, use their powers that they've rightly earned to represent the people that they've been elected to represent. And that's the pathway that this group of workers has chosen to gone, have gone. So that's all I'll say on that.
Okay, thank you. I have Mr. Hawkins next.
Thank you, Mr. Chairman. One of the first slides, it looks like the second slide, to be honest, says the purpose of the bill is to empower nurses so that more will want to come to work in the NWT, communities, et cetera, et cetera. Specifically, what's your evidence to make that particular statement, or is it just a broad statement of hopeful thinking? Thank you.
Thank you. Ms. Morgan.
Thank you, Mr. Chair. Unfortunately, we don't have any sort of case studies that we can look at and analyze evidence from other jurisdictions in terms of when they've had legislation that opens up freedom of association, how many new workers come to that place, because we are the unicorn. We are the only jurisdiction besides Nunavut in Canada that does not have these rights for nurses. And so, no, I can't point to any evidence from other places as to what is going to happen, because we are the outlier in Canada. Thank you, Mr. Chair.
Okay, thank you. Back to Mr. Hawkins.
Thank you, Mr. Chairman. Further quoting the presenter, or the proponent for the bill, that is, she talked about bridging What evidence is that that bridging will actually take place and end up with a better agreement than currently is in place? So what is your evidence? Thank you.
Thank you, Ms. Morgan.
Thank you, Mr. Chair, for the opportunity to clarify. So bridging means that there is no period of limbo where you're left without any collective agreement during some kind of interim period between having one agreement expire, for example, and then another agreement come into effect. And so there is an explicit clause in the bill, on number 6 in the bill says that for greater certainty, any term or condition of employment that applies to nurses who are members of the Union of Northern Workers continues to apply until a collective agreement is entered into by an employees association that bargains on behalf of nurses. So that's what's meant by bridging, that there would be no period in between where you would somehow, that a nurse would somehow lose everything and not be covered or have any agreement. There's never ever a guarantee for anyone who's part of a union that your next collective agreement will be better than your last one. That is not a thing for any worker. If the workers who are currently within the UNW have no guarantee that the next agreement under the UNW will be better than the one they have now. That's just not a thing in negotiation. You come to the table each time, each side presents their positions, there's give and take, there's negotiation. That negotiation starts fresh every time. There's no such thing as like carryover where you get guaranteed everything you had before and more. So hopefully that clarifies. Thank you, Mr. Chair.
Okay, thank you. Mr. Hawkins.
No, I understand the stopgap principle of bridging, but then it starts to the negotiation process. So in other words, you don't have any evidence that the next forward process will create that clarity. Again, I just need to clarify, a bad deal for nurses costs as well. And you highlight the vacancies in process. What further evidence do you have to clarify? Because you say costs continue to pile up. So can you cite the evidence of the cost piling up that will be resolved through this new bill that will save all the labor problems? Thank you.
Thank you, Ms. Morgan.
Thank you, Mr. Chair. I think the member and everyone is aware that we can't guarantee any outcome from a new collective agreement because that's not what a bill can do. All we're doing is giving people the freedom and the option to have a chance to negotiate a better deal for themselves. That's all this is. Of course, I cannot guarantee what the outcome of that negotiation will be. Thank you.
Thank you. Mr. Hawkins.
Just to confirm, how much more time do I have?
2 more minutes.
Perfect. No, that's fine. Well, these are warm and fuzzy statements, so I just want to make sure that that's exactly what they are. So moving on to the next one, speaking of warm and fuzzy, I've heard, and hence the statement isn't the question, but the question is the validity of the question. So in other words, I've heard a statement that this initiative is being supported through the Minister of Finance's office, this whole overall bill. And can you clarify if that is true or not true? In other words, is the Minister of Finance or the Department of Finance in any way supporting this bill or nudging it forward in some package? So in other words, I'm asking you to clear the air in the record officially. Thank you.
Thank you. Ms. Morgan.
Thank you, Mr. Chair. I don't have any inside information that everyone else wouldn't have, and I think we all heard at second reading the Minister of Finance stand up and express her long list of concerns and reasons why she felt she personally could not support this bill as it stands now. So I think we all heard that, and that's where things stand. And I understand that her role in this process will be, as any minister would be, to come and present to committee at some point, and you can ask her yourself what her position or her role is. Thank you, Mr. Chair.
Thank you. Mr. Hawkins.
That in some way answers some of the question, but has the Department of Finance or the minister in any way come to you with support for this particular bill? I was well aware, and as a matter of fact, Mr. Chairman, without taking attendance, I can assure you I was there in attendance when she made that statement. So for the record, have they formulated any support behind the scenes for this particular initiative? Thank you.
Thank you. Ms. Morgan.
Thank you, Mr. Chair. I am quite confused as to what the member is getting at here. I have not had backroom dealings with anyone. There's not some secret conspiracy happening behind the scenes. I honestly have no idea what he's trying to get at here. Sorry, Mr. Chair.
Okay, thank you. Time is up for this round of questions. Mr. Testart.
Thank you, Mr. Chair. So I'm very compelled by what Mr. Gregory had to say about the purpose of the bill was really to allow workers to realize their rights. And I'm very sympathetic to that. At a previous assembly, I made the same arguments around allowing people to form political associations or political parties if they so choose, and that we shouldn't stand in the way of people's rights to exercise their freedom of association. I think, but the reason why we are talking about these other substantive issues related to workplace environment is because the bill has been, even in the presentation this morning and in the debate on the floor, the bill has directly tied itself to better outcomes, or at least to the problems that are there and the potential for better outcomes. So if this was really, if it was a cleaner rationale that it was just about labor rights and freedom of association, then that's what we'd be talking about, I guess. And that's certainly what I'd like to talk about, because I am very supportive of that. Minority rights, when people disagree with the many monopolies we have in the Northwest Territories, whether it's power, labor, housing, there's plenty of these organizations, and it can be hard for minority voices to break through, or indeed in consensus government as well. So I'm pleased to see that that is a rationale behind this bill, and I look forward to the members' support on other initiatives to bring a louder privileges and rights to minority groups in the Northwest Territories. To that end, the Supreme Court certifying process that's laid out in the bill, are there other examples of that in labor regimes in Canada where a court is the arbiter rather than a labor relations board? I just want to know if this is a novel approach to solve a problem, or if it is indeed drawn from anywhere else. Thank you, Mr. Chair.
Thank you, Ms. Morgan.
Thank you, Mr. Chair, and thanks for the question. So no, I'm not aware of another example in Canada where this is the remedy laid out in law because, as was mentioned earlier, every other province in Canada and plus the Yukon has another mechanism laid out in law through some kind of labor relations board to solve these issues. So this is an interim solution being put forward for the Northwest Territories because we don't yet have that similar process as other parts of Canada. But I certainly, issues where workers are challenging or feel that their right to freedom of association is not being respected, that has come to court in the past. And I mean, my fear is that if we continue to shut down options for workers to have their freedom of association, it will end up in our NWT Supreme Court one way or the other. So I'm hopeful that this is a more sort of orderly and respectful way for workers to go about exercising their freedom of association. Thank you, Mr. Chair.
Thank you, Mr. Testart. Follow-up.
Thank you, Mr. Chair, and thank you to the response. Of course, courts really need everything spelt out for them when they're dealing with a process like this, rather than interpreting, because normally when courts answer these kind of questions, it's because a right has been infringed or there's an appeal process. Many of the, like Indigenous governments, for example, have a provision where the Supreme Court will be the court of appeal for a custom elections code or something like that. So it's important that all of those are, all those details are figured out so there's no ambiguity there. Otherwise, a court's going to be potentially frustrated with that process. But it is novel, and I appreciate that our labor regime is structured in a way that this kind of thing is the only way. You got to work with what you've got, unless you're willing to replace and repeal and build something brand new. what was I going to say? So that, I mean, there's a lot of questions around that process, but, you know, and to that point, I mean, like, if there's criticism of saying like, well, we should go with a different process, well, there's no other process available. So if, you know, members or ministers want to change things, then they should bring forward alternative solutions rather than just say, well, this doesn't work, because we still need something done. Ms. Morgan's characterized this as an interim measure, like this, the whole project in this bill. How does, like, what evidence of that in the bill is it that it's interim? Because it seems like it'll be the law of the land. There's no expiry date or another provision like this bill will stand until such time as a labor relations board comes in. So what makes it interim? Because I'm confused on that point. Are we saying it's interim because there's a suggestion? I mean, the sponsor is saying as well that the minister is only committed to a conversation, not committed to action. So to me, this doesn't seem like an interim measure. It seems like a permanent solution within the current labor regime. So can the sponsor of the bill clarify that? Thank you.
Thank you. Over to Ms. Morgan.
Thank you, Mr. Chair, for that opportunity to clarify. It's a good question. So this bill would change Section 41 of the Act until it is further changed. So it would stand. It doesn't have like an expiration date. It doesn't, you know, stop being in effect at a certain point. It's interim until a more comprehensive solution to Section 41 is created by the government. And so when the government does put forward and hopefully enact its comprehensive changes, that would be a rewrite of Section 41. There's no question they would change Section 41. And so the changes that this bill is making are to Section 41. So any of the government's changes later on would automatically just supersede this part of Section 41 that I'm changing. They would, I assume, because they've talked about comprehensive changes, they would take it and they would rewrite Section 41, including the changes that this bill is suggesting here today. So the interim part means it's interim until those comprehensive changes that the government is promising, but otherwise it would, if passed, stay there indefinitely as the de facto solution until the comprehensive solution is brought forward. Hopefully that clarifies. Thank you, Mr. Chair.
Okay, thank you. We have just time for a very quick round three. Ms. Reid, you're up next for that.
Thanks, Mr. Chair. I have two very quick questions, so hopefully we can get into that. Could the member tell us how many bargaining unit nurses they have directly engaged with on this bill, like numbers of nurses? And perhaps they would like to provide that to committee in writing. And can they provide where those nurses are located? Thank you, Mr. Chair.
Thank you. Ms. Morgan?
Thank you, Mr. Chair. I could provide more information about the kinds of consultation and engagement that I've done leading up to this, but I haven't been sort of like formally engaging with units of the UNW. I mean, that option, yeah. You want names? You want just. Okay, I can provide more information in that respect to the committee later on. Thank you. And I mean, I want to clarify too, I am certainly not claiming to represent all nurses or that I've somehow personally done some comprehensive consultation with all nurses across the NWT, and I would never claim that. This bill is giving nurses an option to have a vote amongst themselves. Nurses throughout the NWT. So it doesn't actually matter at the end of the day how I think they should vote. It's giving them an option to have their own vote and have their own choice. Thank you, Mr. Chair.
Thank you. Ms. Reid?
Yep, thanks. And that was not my question at all, but thanks for that, I guess. That's fine and dandy. I guess what I'm trying to get at is that the standing committee is doing that engagement for you, and you've said that publicly, I believe, yeah, so you're nodding yes. And again, that just, it fundamentally disaligns with my perspective on labor. And I can respect the comments that I got on my question previously about going out and being independent, and it opens you up to risk. And I fully understand that. I fully understand where you're coming from, but that's how unions are formed. My specific question, follow-up is, and I think it was touched on a little bit, maybe in a different angle from another member earlier, but can the sponsor please share what jurisdictions or any specific legislation that she looked at when she was working with drafters for examples of best practices when drafting this bill? Thank you.
Thank you. Ms. Morgan?
Thank you, Mr. Chair. As I mentioned earlier, there was really no other parallel jurisdictions to look at, in the sense that every other province and the Yukon in Canada has a fundamentally different way of legislating labor relations, and our Public Service Act is quite unique, aside from Nunavut, in how it even frames or sets up how workers are allowed to organize themselves. Thank you, Mr. Chair.
Thank you. I'm going to turn it over to Mr. Rogers, who hasn't had an opportunity to ask questions yet. Mr. Rogers.
Hi, thank you, Mr. Chair. Yeah, sorry, I've been listening intently, and I'm glad that there's committee members that certainly have a lot more experience with union than I do. It's certainly not a specialty of mine, and I appreciate all the comments. I particularly appreciate the comments from the nurses and members that are here. And I'll always say is this, and I've made a few questions, and I know time is getting there, and I'm going to submit those in through Ms. Morgan myself. But I will say that the one thing this has done, and I can say from this bill coming to second reading, and typically a bill goes to second reading. If it's, we move forward, we get it to committee, and this is where we are discussing it. This one obviously garnered a lot of attention from not only the union, but members outside the union and members in my region as well. So obviously there was some work that needs to be done here, and that likely should have been done, as Ms. Morgan has said and others have said many, many years ago. Whether we can get there with this bill or not, certainly this has brought to the attention, obviously to the forefront. This needs to be done much more quickly, as Mr. Testart and others have said in this room, than our current government is getting it done. So we are certainly, if nothing else, we've accomplished that to this point, that we are actually moving this forward and having this conversation. And I just want to say that I really appreciate that, and I appreciate the work that Ms. Morgan's done to bring this forward. Thank you.
Okay, thank you. I didn't hear a question there. So I'm going to pass it over to Mr. Hawkins for the next round.
Thank you, Mr. Chairman. I can appreciate we're running short of time and process, so I'll try to be a little more succinct this time around. So I appreciate Mr. Gregory highlighting my desire to see an overall healthcare bargaining unit. I think that's primary to my overall concern. I don't stand here to say a nurse is a nurse is a nurse, but I also think that no healthcare worker left behind matters to me, and there are many complementary processes and skills and abilities and talents that all fold together to make the success that we have. So just pointing to that is, why isn't that the approach, noting that this is clearly a one-off for one, recognizing that this eventually will trigger, I can't imagine it can't, but I'll say potentially, I'll be fair, potentially this will trigger other people who will identify that they are more important alone than they are as collective. And the examples I'll give, corrections and peace officers, maybe other types of social workers or other technical fields. I can't predict the future, but if you break the nurses out specifically as to their own, then that will, I can genuinely say, will be a fact of consideration. So why not put forward a healthcare bargaining unit that supports healthcare providers as a collective, as opposed to teasing one group out, such as the nurses only? Thank you.
Thank you. Over to the bill sponsor.
Thank you, Mr. Chair. So there were legal barriers that prevented me from saying in the bill that we're going to create a healthcare bargaining unit because there's no legal definition of what that would mean, who that unit would include, and even if it listed, certain job descriptions, if they're not licensed or regulated by the territory, as most are not still, a physio here still has to get their license from Alberta or BC or somewhere else. There is no way to define in law right now what a healthcare bargaining unit would consist of, who would be in and who would be out. And that's part of the problem with the way Section 41 is structured right now. But we certainly anticipate that once there is some momentum around changing Section 41, and we very much see Bill 26 as part of that momentum and the first step, that indeed freedom might be contagious and others might start to think about how they want to organize themselves too and what makes sense to them and how they want to associate. And as Mr. Gregory pointed out earlier, there's certainly an openness of creating a more inclusive healthcare association that could rally together, could advocate together, maybe even one day could bargain together. So that is certainly an option once this momentum is gained to actually change Section 41 and allow workers to have the freedom to choose how they want to associate. Thank you, Mr. Chair.
Thank you, Mr. Hawkins. Quick follow-up. Oh, I'm sorry, Mr. Gregory.
It's okay just to jump in. I know we're all being conscious of time. I just wanted to speak a little bit to the concerns about, this spreading or and the division of workers, which are legitimate. And, first, I just want to say it's not the intention of us at all to create that kind of spread or disunity within the bargaining unit or within the union. I think when you have a one-size-fits-all bargaining model, you inevitably are going to have those sorts of tensions at all times, and it's about managing those tensions within the bargaining unit and through the union. And I think that's a totally understandable thing if that's the form of bargaining you choose, and it's something that nurses we have to be conscious of, that there's risks and advantages, and it's not all just going to be peachy fine giving up some of the bargaining power that would come from the size and critical mass of a large bargaining unit. But I would just respond with that this is a response to our working conditions, and I'm not sure on how many corrections officers or lab techs, et cetera, that we're flying up on a weekly basis to work here. I don't know how many locum corrections officers we have or how many agency corrections officers we have, or whether the corrections feels that they're under pressure to being outright privatized. But those are the sorts of pressures that we've been fielding in healthcare for roughly a decade, and they seem to get bigger and bigger each year. And so, we're trying to address a workforce under pressure, and we don't know how else to do it other than to try to assert our bargaining power and to have a much more targeted way of applying pressure on our employer in a way that our power is not diluted, because it seems to be a critical moment for healthcare. And yeah.
Thank you. A quick follow-up, Mr. Hawkins.
Thank you very much. Just to be efficient, I'll just say to Ms. Morgan, we are making laws now, so if you're not defined, it's a chance to throw it in the basket of opportunities, and it may not be the intention to single people out or whatnot, but that's exactly what you're doing. So let us not mince words with that. That is what this is doing. And lastly, I'll say that we should be talking about worker conditions, but we're talking about legislation. So my next question, just very quickly, Mr. Chairman, is the characterization, in my understanding, I want to stress that, is there's these subtle hints that the discussions in it that are coming with the GMWT and the UNW can be, maybe, might be fruitless. And we can't wait. There seems to be this urgency that it's only a few months away. What evidence does the member have that that is a fruitless conversation, or potentially a fool's errand to wait for that process? Wouldn't it make more sense to at least have a chance to give it the opportunity to succeed? Thank you.
Thank you. Ms. Morgan?
Thank you, Mr. Chair. So we certainly want to give that effort the opportunity to succeed, and there's nothing about this bill that interferes with it or prevents it from going forward. There's nothing contradictory, there's nothing that interferes. It's impossible for me to prove that something is not fruitless looking forward. What I would like to see as a next step that would certainly give us a bit more confidence is some public statement that, while it doesn't presuppose the outcome of those consultations, at least asserts that there is a common purpose or goal, that the goal of continuing the conversation and looking at Section 41 is fundamentally to allow GNBT workers freedom of association and ensuring that their charter rights are upheld. That would be a great next step to see, to give us a little bit more confidence anyway, that was going in a more fruitful direction. And so far, we just have a commitment to look at it and to talk about it. Thank you, Mr. Chair.
Okay, thank you. And with that, we are out of time for this briefing. So I'm going to just turn it back to the sponsoring member. If you have closing comments, now would be the time for them. Please keep them brief, as we have run over our time, but now would be the moment.
Thank you, Mr. Chair. I will keep this brief. Thanks for your time today, and I want to emphasize that this is about giving a group of nurses the freedom to bargain directly on their own behalf, advocate on behalf of their own profession and their own workplaces and situations to try to make it better. We can't guarantee the outcomes of that, but it is about empowering people to advocate for themselves. And I know we've sort of had mostly Yellowknife members speaking, or members of the Legislative Assembly speaking today, but I just want to go back to the fact that lest us forget that in most of the territory, in most communities, healthcare is nurses. We've got community health nurses in smaller communities. That is the access to healthcare that people have every day in their communities. And we sometimes too often forget about them, and we absolutely, I think if we're prioritizing access to primary care in all communities, if we're prioritizing access to healthcare, I think starting with nurses is a great place to start. You have to start somewhere. You can't fix everything all at once for everyone. And I do truly believe that the process that this bill lays out has merit. I think it can work. And certainly we can continue conversations if committee members have further questions or ideas about how things should be tweaked. But I think the fundamental thing that we're trying to do here that we need to keep in mind is we're giving people the freedom to choose for themselves, how they organize, how they advocate for themselves, their profession, and the communities they serve in healthcare. Thank you for your time, and thanks to everyone for tuning in.
Okay, thank you very much for those comments. And thank you for appearing before committee today, you and the various witnesses that you brought with you. Committee certainly appreciates you making the time, all of you, for coming and helping us better understand this bill. This concludes the public portion of this meeting. As I said earlier, we have another briefing at 3:30 this afternoon with Minister McKay and the WSCC on Bill 29, but this includes the public broadcast for now. Thank you.